Shut your mouth and save your life. This presentation is about how to improve health and decrease stress and illness by changing how you breathe. First, I want you to count how many times you inhale over the next 30 seconds. Just sit back and relax and begin counting now. Stop. Remember that number. Actually, multiply that number by 2, and that'll give you your breaths per minute. And remember that number for later. In August of 2019, I took 2 1.5-hour courses through MedBridge on breathing. These were continuing education units. The instructor drew on information she got from the Buteyko breathing program. I then took 5 live classes on the internet in the Buteyko method. During the first class, my instructor, Carol Baglia, mentioned a book called Shut Your Mouth and Save Your Life, which I then read. The author of that book was famous Native American painter George Catlin. We will begin by talking about his discoveries, then focus on the importance of nasal breathing, diaphragm breathing, tongue position while breathing, reduced breathing, and we will end with a way to estimate your current breathing health. First, a little about George Catlin. Catlin was the first American artist to travel west of the Mississippi and paint portraits of the American Indians from life in their native habitat. His over 500 paintings, from portraits to battle scenes, along with hundreds of artifacts and volumes of notes about native traditions, amassed during his first 6 years of study, formed his Indian Gallery, which eventually came to rest in the Smithsonian Museum. His book, Shut Your Mouth and Save Your Life, is still in print or can be read online for free at buteykoclinic.com. Regarding the book, he said, quote, "If I had $1 million to give to do the best charity I could with it, I would invest it in 4 millions of these little books and bequeath them to the mothers of the poor and the rich of all countries." One of the things Catlin noticed about the American Indians was the beauty of their teeth. Quote, "These people who talk little and sleep naturally have no dentist nor dentifrice, nor do they require either. Their teeth almost invariably rise from the gums and arrange themselves as regular as the keys of a piano, and without decay or aches, preserve their soundness and enamel and powers of mastication." End quote. An important clue to Catlin's great health discovery can be found in his own personal life. Catlin's wife and one of his children died of pneumonia. In pneumonia, breathing is likely to be shallow, rapid, and in and out through the mouth. Shallow breathing prevents the air from reaching the bottom of the lungs. This creates a fertile environment for bacterial growth, and the result could be pneumonia. Catlin himself had suffered the consequences of this, having since childhood developed the habit of breathing through his mouth. Returning from his last trip in 1860, Catlin wrote, quote, "If I were to endeavor to bequeath to posterity the most important motto which human language can convey, it should be in 3 words: shut your mouth." End quote. In fact, Catlin believed that the habit of sleeping with the mouth closed actually contributed to the optimal development of the teeth. Quote, "An Indian child is not allowed to sleep with its mouth open. From the very first sleep of its existence, the consequence of which is that while the teeth are forming and making their first appearance, they meet and constantly feel each other, and taking their relative natural positions, form that beautiful and pleasing regularity which has secured to the American Indians as a race perhaps the most manly and beautiful mouths in the world." He continues, "The savage infant, breathing the natural and wholesome air, generally from instinct, closes its mouth during sleep, and in all cases of exception the mother enforces nature's law until the habit is fixed for life. When I have seen a poor Indian woman in the wilderness lowering her infant from the breast and pressing its lips together as it falls asleep, fix its cradle in the open air, and afterwards looked into the Indian multitude for the results of such a practice, I have said to myself, glorious education! Such a mother deserves to be the nurse of emperors." Caitlin Catlin contrasted the universal Native American wisdom of creating a lifelong nasal breathing habit both day and night in his illustration of the sleeping habits of civilized man. Their mouths wide open, the very pictures of distress, of suffering, of idiocy, of death. Catlin believed that mouth breathing at night affected the whole facial structure. The whole features of the face are changed, the underjaw, unhinged, fails and retires, the cheeks are hollowed, and the cheekbones and the upper jaw advance, and the brow and upper lids are unnaturally lifted. In all these instances there is a derangement and deformity of the teeth, and disfigurement of the mouth and the whole face." End quote. He continues, "I am compelled to believe that a great proportion of the diseases prematurely fatal to human life, as well as mental and physical deformities, and the destruction of the teeth, are caused by the abuse of the lungs in the malrespiration of sleep." Compare this drawing to his drawing of a nasal breather. Mouth breathing chronically has been associated with a host of consequences, as documented by Dr. Alan Ruth in 2015. Introduction of unfiltered, poorly humidified air into the lungs, upper chest breathing, chronic overbreathing, greater incidence of snoring and sleep apnea, bad breath, dental decay, gum disease, dysfunction of the temporomandibular joint, narrowing of the dental arch, jaw and palate, crowded and crooked teeth. Recent studies have shown that sleep-disordered breathing is associated with type 2 diabetes. Up to 50% of people afflicted with diabetes have sleep apnea. Still more studies link sleep apnea with diabetes, obesity, and GERD, gastric esophageal reflux disease. Furthermore, people who suffer from sleep apnea are up to 4 times more likely to have a stroke and 3 times more likely to have a heart attack. For oxygen to be available to our tissues, carbon dioxide levels must be adequate. With chronic mouth breathing, there is an excess loss of carbon dioxide, which reduces oxygen to our bodies. Nasal breathing increases oxygen levels, but also the retention of carbon dioxide. This helps to prevent hypoxia, or low oxygen levels. During hypoxic episodes, one experiences muscle spasms, metabolic acidosis, and increased cellular stress. When we breathe through our mouths, we start to use our upper chest to breathe and don't use the diaphragm correctly. This poor breathing cycle upsets our body chemistry and causes CO2 to decrease to a dysfunctional level in our lungs. This will trigger the brain to halt the diaphragm from working until the carbon dioxide level in our lungs is restored to a healthy level. Because of this, we may get a tight feeling in our chest or have trouble breathing. By directly controlling our diaphragm, the brain tries to limit the amount of CO2 that we lose. In an effort to decrease CO2 expulsion, the brain will also automatically narrow the tubes in our body. From the largest tubes, like our intestines and esophagus, down to the smallest ones, such as the veins and capillaries, our brain will constrict these in an effort to increase our CO2 levels back up into their proper range. Mouth breathing affects much more than our CO2 and oxygen levels. It impacts everything from digestion and the flow of blood and lymph to even our mood and cognition. One method of ensuring nasal breathing at night is to place a piece of tape over the mouth. Several companies sell special tape for this purpose. Here are a few more benefits of nasal breathing. The hairs filter out particles in the air. The mucus has an enzyme that kills viruses and bacteria. The turbinates and sinuses warm and moisturize the air and produce nitric oxide, which improves lung function. Facial features of nasal versus mouth breathers. Mouth breathing affects dental health, swallowing, and the temporomandibular joint. For athletes, nasal breathing will help develop aerobic capacity. Breathing through your nose forces you to focus on efficiency and inevitably forces you into a biomechanically optimal position to access your diaphragm and a full breath. Nasal breathing can also help you nasal breathing can also keep you in tune with your metabolic shifts. Nose in, nose out breathing is highly aerobic. Nose in, mouth out bumps you up to your lactate threshold. Mouth in, mouth out breathing is totally anaerobic. To start experimenting with nasal breathing training, use the nose in, nose out only in your warm-up and start when you have to breathe through your mouth and stop when you have to breathe through your mouth. When you get the hang of that, progress to using nasal-only breathing in a workout. Commit to 2 weeks, any training you do, and see what you learn. Quote, I tried using a heart rate monitor, but it would give me inaccurate readings, so I decided to try nasal breathing, says Josh Catlin, co-race director of the Trail Animals Running Club race series and course record holder of the Don't Run Boston 50K and 50 miler and the Wapak and Back 50. Quote, for close to 6 months, nearly all of my runs were performed using nasal-only breathing. It felt really slow, but it gave my body the chance to build a huge aerobic base and taught me how to pace myself optimally. Another athlete states, quote, nasal breathing skills have been instrumental in bringing my running performance to the next level, says David Grimm, 40, of Freeport, Maine, who recently completed his first 100-mile race with the Vermont 100 endurance run. He continues, focused nasal breathing has not only delivered noticeable aerobic benefits, but it has also become a gauge and throttle to manage my intensity and exertion. Let's look now at upper chest versus diaphragmatic breathing. There are several effects of upper chest or thoracic breathing. One of them is the activation of our fight or flight system, the sympathetic nervous system. If a person is constantly thoracic breathing, it is like living in a state of emergency all the time. This will affect digestion, sleep, healing, the ability to relax, and also causes lymphatic stagnation. The solution is diaphragmatic breathing. Hyperventilation is the main and generally the only cause of chest breathing in modern people and their inability to enjoy the diaphragmatic breathing benefits. Why? Because alveolar hypocapnia, fancy word for low CO2 levels, leads to hypoxia or low O2 oxygen levels in body cells, including the muscle cells of the diaphragm. As a result, the diaphragm gets into a state of spasm. If breathing gets slower or closer to the norm due to breathing retraining, the oxygen level in the diaphragm will increase, and it will be again the main respiratory muscle used for breathing at rest.
Diaphragmatic breathing, aka belly breathing, is our most efficient breath. It's also a calming breath. It taps into the nervous system and tells it to calm down. When we were first born, if there weren't any complications, we were all born as belly breathers. As we get older, we tend to become more thoracic chest breathers, much like this. So I'm going to teach you how to breathe with your belly. Start by laying down on your back. Place one hand on your chest and one hand on your belly. Take a slow, deep breath in through your nose. Feel your belly rise. Breathe out. Feel your belly flatten. Try to keep the hand on your chest as still as possible. Repeat for 10 breaths. You may place a small object on your belly instead of your hand, and you'll notice it moving up and down. Let's move to a standing position. Put one hand on your chest, one hand on your belly. Breathe in slowly through your nose. Feel your belly rise. Breathe out. Feel your belly flatten. Try to keep your hand on your chest as still as possible. Repeat for 10 breaths. Finally, let's come to a comfortable seated position. Place one hand on your chest and one hand on your belly. Breathe in slowly through your nose. Feel your belly rise. Breathe out. Feel your belly flatten. Try to keep the hand on your chest as still as possible. Repeat for 10 breaths. Practice belly breathing in all three positions: lying down, sitting, and standing, twice daily. Complete 10 good belly breaths in each position. These are the steps to learn belly breathing. Eventually working your way up to breathing with your diaphragm while exercising. The more you practice this, the quicker diaphragmatic breathing will become your automatic breathing pattern again.
Maybe you tried that while you were watching that video. If not, go ahead and try it now for a couple breaths. Put one hand on the chest and one hand on your stomach. And on the inhale, try to make that hand on your stomach rise and fall. You can do this laying down or sitting or even standing. Ideally, we'll get to do this, we'll become diaphragmatic breathers nearly all the time. Now, as a therapist, I was taught what's called pursed lip breathing, where you inhale through the nose and exhale through the pursed lips, like you're cooling off a spoonful of hot soup, is what I would tell my patients. Some people will say, like you're blowing out a candle. The idea there is that the exhale would be very slow. Most of my patients had a hard time with that and would still exhale far too fast to be beneficial to them, resulting in them blowing off too much of their CO2 and actually defeating the purpose. I now teach everyone to simply exhale slowly through the nose. Now, this has the added advantage of rewarming and humidifying the sinus and nasal passages prior to the next inhalation. So you're benefiting from that breath going back out through your nose. Diaphragmatic breathing stimulates the cleansing work of the lymph system by creating a negative pressure pulling the lymph through the lymph system. This increases the rate of elimination of toxins from visceral organs by about 15 times. Why is this so? The lymph system, unlike the cardiovascular system with the heart, has no pump. Lymph nodes are located in parts of the human body that get naturally compressed due to movements of body parts. For example, lymph nodes are located around the neck, above the armpits, and groin area. Hence, when we move, stretch, or turn the head, arms, and legs, these lymph nodes get mechanical stimulation to push the lymph through the valves. However, the lymph nodes connected to the stomach, kidneys, liver, pancreas, spleen, large and small colons, and other vital organs are located just under the diaphragm. This accounts for over 60% of all lymph nodes in our body. Hence, nature expects us to use the diaphragm in order to remove waste products from these vital organs, literally with each breath 24/7. Hence, another problem with upper chest breathing is a stagnation in the lymph system and the accumulation of waste products in vital organs located under the diaphragm. Please note, a deep breath doesn't need to be a big breath, just deep, as in down to the lower lobes of the lung. I also tell my patients that this will help prevent pneumonia, improve sleep, it can short-circuit a panic attack, improve digestion, and use less energy. Now let's watch a video describing this diaphragmatic breathing.
Deep breath. If you feel like you're going up and getting a little bit taller, you're breathing so wrong. Breathing wrong is when you use your neck and shoulders to pick up your thoracic cavity. So do this now. Take a deep breath and watch. If you feel like you're going up and getting a little bit taller and then you come down and settle down on your exhale, it's actually a dysfunctional breath. At 5 and under, I've found that most kids breathe perfectly. So a number of things happen so that when you ask a 10-year-old to breathe, they start breathing with that upper body breath that's actually anatomically incongruous and leads to us being in fight and flight, more anxious, having neck and shoulder pain, not being able to sleep, and having digestive problems. So how did we get there? Number one is that child starts sitting a lot. They start going to school. We sit way too much, 13 to 16 hours a day. Number two is injuries. If you're a little kid and all of a sudden you start skateboarding or skiing, anything that hurts the middle of your body, you immediately stop inhaling and expanding because it hurts. And your breath goes all the way up here to be an upper body or a vertical breath. You start wearing waistbands, bra straps, compression garments. You start sucking in your gut, and all of a sudden that breath that was perfect before you were 5 turns into a dysfunctional one as an adult, and it stays there until you fix it right now. A good breath, a breath that's anatomically congruous, it goes with the rest of your body, is that you inhale and you expand your body. Neck and shoulders don't move. You expand all the way around, 360 degrees. You come forwards a little bit, your sides open up, and even your back opens up. And if you want to see what this looks like, look at your dog, your cat, your fish, any animal on the planet except for us, and you'll see them breathe perfectly, 360 degrees all the way around, expanding on the inhale and contracting, wringing out, getting narrower on the exhale. No neck and shoulder movement.
Watch now as the ribs expand with each inhale.
Pulmonary ventilation, or breathing, is induced by changes in the volume of the lungs and the air pressure within them. During normal inhalation, the diaphragm and external intercostal muscles contract and the rib cage elevates. As the volume of the lungs increases, air pressure in the lungs drops below atmospheric pressure and air rushes in. During normal exhalation, the muscles relax, the lungs become smaller, pressure inside them rises, and air is expelled. Boyle's law explains this relationship between volume and air pressure. An increase in the volume of a container lowers the pressure of the air inside. A decrease in the volume raises pressure in the reduced space. The body's demand for more oxygen can change normal breathing to forced breathing. Additional muscles increase the changes in volume of the thoracic cavity so that more air can pass in and out more rapidly.
So, now that we are breathing through the nose and with the diaphragm, we need to look at tongue position. Mouth breathing and poor tongue posture go hand in hand. Nasal breathing is the most effective way to control aberrant tongue function. Tongue thrust is natural in infants. When the infant first starts to eat solid food, food spills out of the mouth. All mothers are aware of this because one must scoop the food off the lips with a spoon and place it back into the infant's mouth. Tongue thrust serves a useful purpose in infants because it keeps the tongue from falling back into the throat and helps with swallowing because the oropharyngeal or throat regions are growing at a rapid rate. At about 6 months, the infant starts to outgrow the tongue thrust and starts to place the tongue at the roof of the mouth, which helps shape and develop the structures of the head and neck. This is done automatically as determined by genetic code. The rampant use of pacifiers and sippy cups places the tongue toward the lower jaw and prolongs tongue thrust and encourages mouth breathing. Soon it becomes ingrained, and the habit is set for a lifetime. The most effective way to control the tongue during swallowing is through nasal breathing. Nasal breathing places the tongue at the roof of the mouth where there is the naturally occurring lip seal and tongue suction. During swallowing, the tongue presses against the roof of the mouth and sends a normal and powerful peristaltic wave, sending the bolus of food straight into the stomach without trapping any air. Watch this video.
So one of the first things I have to ask my patients or people that I'm evaluating for a myofunctional issue is, where does your tongue rest when it's sitting inside of your mouth? Where does it naturally go to? So I break this up into two different descriptions. So does your tongue rest high in your mouth, like so it's against the palate? Does it rest in the middle somewhere? Or does it rest like laying flat in the bottom? This is usually how it is for people who have myofunctional issues. Your tongue will be resting middle or in the bottom of your mouth. Then to get a little bit more specific, I always ask people, where does the tip of your tongue sit? So the very tip of your tongue here, does that sit below your lower front teeth? Does it sit between your teeth? Or does it sit above or against your front teeth? So try to figure out where your tongue sits inside of your mouth. And it should be, I'll tell you this little secret, it should be sitting high in the roof of your mouth, and it shouldn't be pushing against or between your teeth in the front. So that's very important if you notice that your tongue is pushing against your teeth. If your tongue is not resting high in the roof of your mouth, I'm talking about like this is the top of your mouth and your tongue is like filling the entire space of your mouth. There's no air inside your mouth. This means that your tongue is laying flat and that you have a tongue thrust. And it probably means your mouth is open as well if you're not paying attention to that. So, like I said, just to recap, your tongue should be high, touching the roof of your mouth, not against your front teeth or between your front teeth. And you should feel no air space within your mouth. So your tongue should be like filling the whole thing, and there should be no feeling of air or space inside your mouth when your mouth is closed and your lips are together. Hopefully, you guys are all doing that, and if not, contact me and I'll set up an evaluation for you. You probably need myofunctional therapy.
Okay, can you cluck or pop your tongue? Try it. Now, instead of making the clucking sound, just leave the tongue suction to the roof of your mouth. That should be very close to its ideal normal resting position. The way we can all improve our health is to reset our breathing so that it is light and calm the majority of the time. Otherwise, reduced breathing. The Buteyko breathing technique has proven able to do this even with severe asthmatics and diabetics. Artur Rakimov has a website called Normal Breathing with much more information. He shows that average liters per minute, what's known as minute ventilation, has risen significantly since 1940 and claims that 90% of people are over-breathing. The Buteyko method was developed in the 1950s by Russian medical scientist Professor Konstantin Buteyko. Professor Buteyko's exhaustive research led him to discover that several hundred chronic diseases could be scientifically explained as a consequence of habitually breathing above the physiologically recommended norm, otherwise known as chronic hyperventilation syndrome. It occurred to Professor Buteyko that if he could retrain the breathing pattern so that it reverted toward the norm, he could reverse these diseases. After years of experimentation, Professor Buteyko managed to develop a process to normalize the breathing pattern, which has, over the last 50+ years, enabled tens of thousands of people to reverse their chronic diseases. This system or approach has become known as the Buteyko method. Patrick McEwen has carried on Professor Buteyko's work and offers extensive online and in-person training. Look online at buteykoclinic.com. Here are some of the benefits of this method: increased stamina and energy, improved ability to cope with stress, improved quality of sleep with reduction in snoring, reduction in allergy symptoms, reduction in asthma symptoms, less susceptibility to colds and flu, and fewer headaches. In order to see why reduced breathing is so beneficial, we need to understand a little more about the role of CO2 in respiration. CO2 plays many roles in our health. The following are a few that I thought would be most important for this discussion. Oxygen distribution. CO2 determines the strength of the bond between oxygen and hemoglobin. A low CO2 content strengthens the bond between hemoglobin and oxygen, so it is more difficult for oxygen to leave the blood and go to the body cells that need it. This principle is known as the Bohr effect and was discovered in 1904 by the Danish scientist Christian Bohr. This principle means that when you are in a state of rest, you can try to get more oxygen by breathing more, but it will result in decreased oxygen release by the blood due to lower CO2 content. So to get more oxygen, you have to breathe less. Compensation mechanisms. The body may compensate for the lack of usable oxygen caused by low CO2 by raising blood pressure and heartbeat. Higher blood pressure helps push more oxygen out of the blood, while a higher heartbeat pumps the blood around more quickly, helping deliver a bit more oxygen too. Obviously, these two compensation mechanisms create other problems on the long term. When you think about it, this is an intelligent physiological response to a lack of oxygen. But then what happens? The doctor prescribes medications to lower blood pressure, which then results in even less oxygen getting to the tissues that need it. So heart rate has to increase again, and around we go. So without first looking at the person's breathing, the medication is going to make the situation worse. Balanced blood pH. A drop in blood CO2 content immediately causes blood pH to become more alkaline. This change in blood pH negatively influences the activities of all 1,000 plus enzymes and vitamins. When the blood pH reaches 8 or higher, the organism dies. We need CO2 to maintain balanced blood pH, which works by using the bicarbonate buffering system of the blood. Constriction of passages. When CO2 is low, airway passages and blood vessels constrict and become narrower. With higher CO2 content, these passages relax and increase in diameter, allowing for improved flow of air and blood. CO2 acts as a relaxant for the smooth muscles of the airway passages or bronchi and blood vessels. In fact, with slowed, reduced breathing, you will notice that your feet and hands will stay warmer because those blood vessels are opening and you're getting the oxygen to the tissues. Next, excitability of the nervous system. Low CO2 levels increase nervous system excitability. Small stimuli can then easily cause a big reaction, causing the nervous system to enter a state of permanent excitement characterized by high stress, low relaxation, and low ability to focus. Know anybody with those symptoms? Also, the numbering here is off because I just picked 6 out of 10 of these listed benefits of CO2. Number 10 is immune system. A low CO2 level weakens your immune system by lowering the antibody-antigen affinity. This means that it becomes more difficult for your antibodies to attach to and disable viruses and bacteria. Proper carbon dioxide levels, which regulate the healthy, narrow pH range of the blood, allow for the adequate release of oxygen to our tissues and our brain. Many of us throughout our lives have been given the vague impression that CO2 is bad for us. Quite the contrary. Without CO2, we wouldn't get the oxygen we need. Proper CO2 levels are what trigger our red blood cells to release the oxygen they carry. Functional adult breathing is 8 to 10 breaths per minute at rest. In and out through the nose, not through the mouth. Driven by the diaphragm, not by the upper chest. Most importantly of all, breathing should be silent. If breathing can be heard, it's not functional. So did you catch that? 8 to 10 breaths per minute would be your optimum. When we started, how many breaths, inhalations did you take in the 1 minute that we timed? Was it above 10? In the hospital where I work, we consider 12 to 18 breaths per minute as normal. And many of our patients are well up into the 20 breaths per minute and some up to 30. In reality, breathing lightly and only through the nose is the ideal technique for relaxation and optimal health. When done properly, you will experience a reduction of stress and strengthening of the immune system. Dr. Buteyko developed a test to measure the depth of breathing and consequent retention of carbon dioxide, resultant oxygenation, and overall health status. He named it the Control Pause Breathing Test. What you'll do is sit down, close your mouth, and breathe normally through the nose for about 30 seconds or so. Then you'll take a normal breath in through the nose, allow a normal breath out through the nose, then gently close your nose with thumb and forefinger of one hand and count the seconds until you feel that first need to breathe. Don't go as long as you can. Wait till as soon as it starts to feel uncomfortable, let go of your nose and resume normal breathing as soon as you can. The number of seconds that passes is your control pause. Okay, so let's go ahead and try that now. Why don't you just sit calmly? We're gonna just sit and breathe normally through your nose for about 20 seconds here. Again, it helps to have an upright sitting posture. You could even do it standing. Now, take a normal breath in, normal breath out. Hold your nose with the thumb and index finger and count how many seconds you can go until you feel the need to breathe again. If you're still going, that's great. If you've released your nose because it was getting, you had that desire to breathe again, that's fine. Just remember how many seconds that was. Okay. Now, this is what Dr. Buteyko discovered, that our health state can be related to our control pause. Here you see the lifestyle factors, for instance, energy level. If your control pause is less than 30 seconds, your energy level could be medium, but it also may be low or very low. If your control pause is 50 seconds or more, you're going to have a very high energy level. This affects all areas. Craving for sugar and junk food, I thought was interesting. You're going to have those cravings if your control pause is under 30 seconds, but Dr. Buteyko found that those who had a higher control pause had no cravings, and addictions to smoking, alcohol, and drugs were also absent. They had good focus, concentration, and clarity, and they enjoyed exercise. Here's a graph showing the amount of carbon dioxide that is in our systems based on what our control pause is. So for the person with a control pause of 60 seconds, you would have approximately 6.5% carbon dioxide. If your control pause is only 5 seconds, your carbon dioxide level is only going to be about 3.5%, and you are not going to be very well. So there's a continuum there for our health. For more information and for exercises to help improve your control pause and thus your health, I recommend Buteyko Clinic International and and this is a book by Patrick McEwen, and he also has a number of videos on YouTube that you can watch for free. Another option is to contact the instructor I went through, Carol Baglia. She is a Buteyko educator and trainer, and here is her contact information. She's very good, and she will customize the program specifically to your health needs. All right, thank you very much for watching this video.